Good morning everyone. Today we are going to discuss about factors affecting the fixation. There are so many factors affecting the fixation. These are the example. Hydrogen ion concentration, that means pH of the fixative, the temperature of the fixative, the duration of the fixation, and the osmolality of the fixative solution, the concentration of the fixative, and the agitation. These are the factors affect the fixation. So when we consider the hydrogen ion, most of the fixative works better in neutral pH. In fact, the good fixation occur when pH remains 6 to 8 and no morphological deterioration is seen in that range of pH. There may be changes in the ultrastructure when the pH is too low or too high. In very low pH, the NH2 group of amino acids is converted to NH3 and the reaction between aldehyde group of the fixative is reduced. Usually, buffer solution is added to maintain the pH of the fixative. Commonly used buffer in the fixatives are phosphate, bicarbonate, tris, and the acetate. The buffers should be chosen in such a way that they should not react with the fixative. Then we will consider the temperature. Tomb temperature is alright for the tissue fixation, and there is no difference of cell morphology from 0 to 45 Celsius. However, the fixation time may be reduced in high temperature. It means 60 to 65 Celsius. At higher temperature, the vibration and movement of the molecules are increased. This increases the rate of penetration of the fixative within the tissue and accelerate the process of fixation. In case of very high temperature, the antigen within the tissue may be destroyed and the enzymes are better preserved in low temperature. And for the enzyme histochemistry, normally we have to choose 0 to 4 Celsius. So duration of fixation, the depth of the penetration of fixative is directly proportional to the square root of the time of fixation. The diffusibility of the different fixative may vary. That means D equal to K into square root of time. The penetration rate of the formalin solution is 1 millimeter per hour. The presence of blood may hamper the penetration of the fixative. That means if the tissue contain blood, it will block or reduce the penetration. So therefore it is preferred to wash the tissue specimen thoroughly before putting into the fixative. Normally in operation theater, if the surgeons they are removing the specific part which are used to identify the histological detail, so after surgery they will send the sample. During that time, inside the operation theater who are working there, they should actually the medical laboratory scientists, they should the consider these things. If the blood is present in the tissue, it will reduce or the block the penetration. So before putting into the fixative, the tissue should be washed thoroughly, and the tissue should be sectioned as 3 to 5 millimeter. So then only it is the fixative easily penetrate. If the thickness is very if the thickness is higher, the penetration rate is low. So the tissue not get the even penetration. So overall, formalin fixes the tissue within 24 hours. Prolonged fixation may cause loss of lipid and the protein, and significant reduction of the enzymatic activity of the cell. This may also cause hardening of the tissue. So we have to consider these things. So when we fix the tissues in prolong, what happen, it is will lose the lipids and protein part in the tissues, and same time if the enzyme is present, it will significantly reduce the activity. So if we want to identify the enzyme in the specific tissue, so we have to maintain the time duration, and we have to choose the specific fixative. Then sometime if we keep prolonged time, it will harden the tissue. Then when we consider the osmolality of the fixative solution, osmolality of the fixative has considerable effect on fixation. Hypertonic solution fixative, it is causes the shrinkage of the cell. So here hypertonic fixative solution, that means it's contain high concentration of solid parts. So what happened, so the water molecules, it's removed from the cell to the solution. So what happened, the cells, it will remove the water molecule, it causes the shrinkage. So if hypertonic fixative solution induce the swelling of the cell. In here what happened, hypertonic solution mean the water, when we consider the fixative and the tissue, the fixative contain high amount of water. So the cells contain the high concentration of solid parts. So water molecule move from fixative to cell. So that's why the cell gets swelling. Electrolyte, normally we use for this one 0.9 normal saline or sucrose may be added to the fixative to maintain the osmolality of the fixative. Mildly hypertonic fixative, normally it's contain the osmolality 400 to 450 milliosmol, is preferable for the routine use in laboratory. So we have to maintain osmolality of the fixative normally 400 to 450. If it is increased more than that, what happened, the cell shrinkage. If the osmolality is reduced, what happened, the cell gets swelling. So here, to avoid this one, we have to use the electrolyte or sucrose solution. These are the example. Hydrogen ion concentration, that means pH of the fixative, the temperature of the fixative, the duration of the fixation, and the osmolality of the fixative solution, the concentration of the fixative, and the agitation. These are the factors affect the fixation. Agitation. The agitation increase the rate of penetration and therefore rapidly of fixation. So when we are use agitation, what happen? The penetration rate increase, so it will rapidly fix the tissue. Optimum agitation is needed as slow agitation. So here we need optimal agitation. Otherwise, if we use slow agitation, it may cause no effect of the fixity. So slow agitation, no use, no any effect. But if the agitation is rapid, it may have the detrimental effect on delicate tissue. So we have to consider these things. So thank you very much.